everyone, and happy Sunday. So as requested, today we're going to do a two-part series on dry eyes. Let me share my screen with you. I hope everyone can see my screen. Perfect. So what is dry eyes? So dry eye is a condition that affects your tear film, the 3 layers of tears that cover and protect the surface of your eyes. Everyone needs a smooth and stable tear film to aid in one seeing clearly and comfortably. Disruptions to tear film can cause uncomfortable symptoms. Many different factors can prevent your tear film from working as it should and lead to dry eye, causing healthcare providers to consider dry eye a multifactorial disease. So what causes and types of dry? What are the causes and types of dry eyes? So dry eyes happen when your eyes don't produce enough tears. Your tears evaporate too quickly, and both of these happen together. Many different factors can make you more likely to develop dry eye disease or have symptoms that get worse over time. So what are some types of dry eyes? You have one called aqueous deficient dry eye. This is when your eye don't produce enough tears. You have evaporative dry eye. This is when your tears evaporate too quickly. And then you have what's called a mixed dry eye, where some people have aqueous tear deficiency and tear instability. So what are the signs and symptoms of dry eyes? Many of you can probably tell me this. So when you have dry eye, you might feel like there's something in your eye that just won't come out. This can feel like a scratchy, gritty, or sandy sensation. Symptoms may also include burning or stinging, feeling sensitive to light, blurred or change in your vision, mucus that comes out of your eye, watery eyes with excess tears running down your cheeks. So what can dry eyes be a sign of as well? Dry eye may occur on its own or along with other medical conditions. In some cases, dry eye is a sign of Sjögren's syndrome. About 10% of people with aqueous deficient dry eye have Sjögren's syndrome. Diabetes. If you have diabetes, there's about a 50-50 chance you'll develop dry eye as a complication. Thyroid eye disease or blepharitis. So what are some risk factors for dry eyes? Some risk factors you can't control. For example, the older you get, the more likely you are to develop dry eye. But other risks you may be able to manage through lifestyle changes or adjustments to your medications. Talk to your provider if you have any of the risk factors listed initially and those that I'm going to be talking about. You may be able to make some changes to lower your risk for dry eye or lessen bothersome symptoms, like environmental and lifestyle factors, things like the weather. Those are things that you can't really control that, right? Looking at screens for long times, contact lens use, smoking, or allergies can increase your risk for dry eye. Medications, so taking certain medications can increase your risk for dry eye as well, including some that are oral contraceptives or systemic retinal scan increase your risk as well. Blood pressure, glaucoma, menopause and pain, anticholinergics, those things as well. Medical conditions, many different neurological conditions, eye conditions, autoimmune conditions that I just described some of them earlier, and endocrine conditions can raise your risk of dry eye. Surgeries. Some eye surgeries increase your risk of dry eye, including LASIK surgery, cataract surgery, and surgery of your cornea. So how is dry eyes diagnosed and tested? Your provider may ask you to fill out a questionnaire to learn about your symptoms and medical history. That's why it's important for you to be a good historian. And when you're having symptoms, you write them down, no matter how minor you may think they are. They could be very important. You should be prepared to provide lots of information, including the following: eye-related symptoms and how long you've had them, environmental factors that make your symptoms worse, other symptoms including dry mouth, cavities, mouth sores, fatigue, and joint pain, allergies, history of any kind of eye disease, history of other medical conditions including allergies and chronic viral infections, history of surgeries, whether you smoke or are around secondhand smoke, how often you wash your eyelids, and what products you use. History of trauma or eye area, and into your eye area. Now, personally, I developed some eye problems because of makeup. I used to do a lot of eyeliners before I got saved, and I actually developed eye problems with that. So be careful of things that you're putting on your eyes, okay? Tests that diagnose dry eye. There's no single test that diagnoses dry eye. Rather, providers may use many tests, including what's called a slit lamp test, Schirmer's test, and what's called a tear breakup time test. I'm sorry. Healthcare providers also may order other tests, such as antibody tests, to check for underlying conditions that could be causing your dry eyes. Next Sunday, we're going to talk about the management and treatment of dry eyes. Can you prevent dry eyes? If you have dry eyes, does it go away? Living with dry eyes and statistics on dry eyes. Thank you so much for your time. I hope this little small segment, I'm trying to do it in small pieces so you can retain a little bit of what I'm saying. And then you can also join me in the Zoom room immediately after service should you have any questions. God bless you and have a wonderful, wonderful rest of the day.